Hello, I'm Shivika Nath, Senior Anchor for the National Library of Patient Rights and Advocacy. Have you recently had an appointment with a primary care physician or even a specialist and noticed a change in the way your visit is conducted in terms of who you see and who examines you? Well, you are not alone. There was a chart today where the patient is brought into the examination room by the medical assistant. They take your vital signs, and the next person you see is either a certified nurse, practitioner, or a physician assistant, neither of whom is a doctor. Another possibility is that you might first see a young doctor who is doing a fellowship in primary care or the specialty. Today, my guest is Bob Kaiserman, who is the founder and former executive director of the National Library of Patient Rights and Advocacy. Bob is the retired chair of the Healthcare Administration program at the Arcadia University School of Global Business near Philadelphia. He is an author, an editor, a publisher. Welcome, Bob, and thanks for joining us. Please first explain the major differences between a certified nurse practitioner and a physician assistant.
So a certified nurse practitioner is a nurse who has gone to undergraduate school, typically gets a BSN, which is a Bachelor's of Science in Nursing. Then he or she goes beyond that and gets a master's degree. And when they go to get a master's degree, many times that they specialize in a certain area of nursing. And with more training and more credits, they become eligible to become a certified nurse practitioner. So it's basically experience and education. What makes them different than other nurses is that they are allowed to prescribe medicine. They are allowed to diagnose a patient. And a nurse, an RN, a registered nurse is not. Very often, a practice can use them instead of a doctor to examine the patient. Now, they have been given the right to write the prescription and diagnose independently. So they're very valuable. You often find them in colleges and universities and camps and so forth, and urgent care centers. A physician assistant doesn't doesn't have as much education as a certified nurse practitioner. They go to undergraduate school, typically become a biology major or a chemistry major. And then they go to school for 2 years. They get a master's degree in something called medical science.
Mhm.
And what they're allowed to do is they also are allowed to prescribe medicine and they're allowed to diagnose, but it's under the supervision of a physician, either a medical doctor, an MD, or a DO. So there is a big difference between the CNP and the PA. Both are important in the healthcare system. Both are being used in the healthcare system. But the big difference is a certified nurse practitioner has what we call more scope, which means
Mhm.
they have more ability to do things. That's the basic difference between the two.
So, why do you think it is becoming common for a patient to see either the CNP or the PA for most of the visit, and the actual doctor for 5 or 10 minutes at the end of the visit?
Well, one issue is money. The other is time.
Mhm.
Um, Many physicians, once upon a time, they were working for themselves. They had their own private practice. Today, they are mostly employed by hospital systems. They have a boss. Once upon they didn't have a boss, now they do have. And the boss, the company that runs the hospital, says, or the private practice, says that they have to see so many patients per day. And they can't see as many patients if they're the only ones providing the service. So what they've done is they've brought on the CNPs and the PAs, basically handle what we call routine uh, experiences, as opposed to something called diagnostic. Difference being that the routine is when somebody comes in for a complaint, a medical complaint, a follow-up visit, um, and very often the CNP and the PA, whether it be in primary care or in a specialty, capable of examining the patient. Now, if the patient presents problems that are pretty extensive, then the doctor is going to get more involved, the MD or the DO. So in many practices, that's the way the model stands, that the PA and the CNP see the patient primarily, and maybe at the end of the visit, the doctor comes in and meets with the patient, just to show face, first of all, and also to sort of follow up what was done by those two people. So one is money, one is time. Concept of medicine called triage. Triage is determining who's in worse situation than another. We find that in an emergency room. When people come into an emergency room, there's usually a triage nurse who brings people into a small office, and he or she decides how serious their problem is. If they are clutching their chest and they think they have a heart attack, then obviously they get put right into the back of the emergency room. If they cut their finger and they have stabilized it with a Band-Aid, they may have to wait a little bit. So that's called triage. So these two people, the PA and the CNP, also do triage. Um, the other thing is the age of the doctor. Many doctors are retiring. They're of retirement age, and they're trying to work less. Still working, but they're trying to work less. So by having the CNP or the PA as the primary providers, they don't have to work as hard. So it's a matter of um, having somebody else help you. That's the best way to say it.
From your observations, what is the overall reaction by patients to this practice model?
Good question. Um, most patients, I think, are accepting it. I know at first, when I went to the doctor and this happened, I sort of said, "What happened to the doctor? Why? I've always seen the doctor. Why am I seeing the PA or the CNP?" But I think people are getting used to it.
Mm,
I never the person, another person you mentioned at the beginning was a fellow. What's the difference between a fellow and a CMP and a PA is a fellow is a physician. Fellow is either an MD or DO. They finish their residency and they're doing a little bit more time in the practice to nurture their craft. And I have an interesting situation where I go to a urologist, as most men do. And the fellow was very, very personable, very knowledgeable, very down to earth. And I got used to talking to him more than I did to the doctor. Not that my doctor is not a good guy, he's a good guy, smart guy. But I was being examined more and counseled more by uh, the fellow. And
mhm.
so a lot of people are using the fellow. Now, how do people feel about this? I think that they're more comfortable perhaps with the fellow, or I guess we'll talk about that in a little bit. Um, but I think most patients are accepting of it. Um, the other thing that happens is that if someone's not feeling well, very often, especially in primary care, you will get a visit much faster with a PA or a CNP than you were with a doctor. So for many patients, that's a wonderful thing. If they're
Mm.
not feeling well, they want to get in and be seen. So they are thankful for that opportunity, and they put, you know, that's what they think is going to help them if in fact they're really not feeling well. But basically, that's the overall reaction. It's a positive reaction.
Do you think trust becomes a factor in this model for the patient?
Um, yes, if people have trust in their doctor and really admire their doctor and respect their doctor. I think that the fact that the doctor has chosen this certified nurse practitioner or this physician assistant gives the patient more trust. And they don't doubt that, why am I being treated by these two people? And I came here to see the doctor. So, the answer to your question, I think, yes, that creates more trust. And it also gives trust in the practice that they're doing things in the practice to respond to the patient's needs, patients more frequently. You don't have to wait months and months to see a doctor. So it's all positive, I think, very positive.
As for seeing a fellow, do you find that patients are more comfortable with the fellow conducting the visit and the examination?
Yeah, as I was talking with my own experience, I think that they are. As long as the fellow assures the patient that they know what they're doing.
Hmm.
Um, I think that they probably have more credibility in the mind of a patient than maybe a CNP or a PA, because in fact this person is a doctor, and they've gone through medical school, they've gone through the residency. They're like on the cusp of practicing by themselves. So I think that most patients enjoy being seen by a fellow and they can accept that, and maybe they accept that perhaps in some cases more than they do being seen by a CNP or a PA. But yeah, I think
Hmm.
it's a very positive feeling when a patient is told that they're going to see the fellow before they see their doctor. They feel more comfortable.
Finally, do you see this model changing the healthcare delivery system of the future?
I do. Um, I think this is for another time, but they're seriously talking about giving PAs a doctorate,
Hmm.
like they do a physical therapist and a speech pathologist. And when that happens, I think they're going to give the PAs more scope.
Hmm.
Probably what will happen is if a PA can, and they'll probably have to go to school more and have more clinical experience before they're given that doctorate. But if that changes, what's going to happen is probably that they're going to give the PA more scope. They'll allow them to write prescriptions by themselves and diagnose by themselves without the supervision. In which case, we'll have three practitioners basically treating patients: a nurse practitioner, a PA, and a physician. Um, and I think that well, we're starting to see it now. When they build an urgent care center, typically there's not a physician there. There's either a PA or certainly it's a nurse practitioner. So as as the doctors retire and their patients have more demands, I think that this may change the model of healthcare delivery. And the patients will have to decide, as I said earlier, whether they want to accept this model or not. But many cases, people, I guess, are more grateful that they get in to be seen than to wait 6 months to see the doctor. So that's probably one of the most positive parts of this. From the practice standpoint, as I said, they do save money and they can see more patients. When they see more patients, they make more money. So they save money on the fact that the doctor doesn't have to always be there every patient. It saves the doctor's time and it also makes more money for the practice because obviously they're seeing more patients.
Hmm.
So I think that, yes, I think that, I don't know how soon, but I think this is where we're going, especially with primary care. With the specialties, a little bit different, but because many times people go to a specialist only for the reason they want to see this doctor, because
Hmm.
this doctor has a this is an expertise. They've done more surgeries, done more diagnoses. You go to a specialist because that's what they are, a specialist. Um, I think this is going to affect more primary care and urgent care than it will specialists.
Thank you, Bob Kaiserman, for being my guest. This has been a very interesting conversation. I am Shivika Nath for the National Library of Patient Rights and Advocacy. Thank you for joining us.